At the University of Cincinnati Cancer Center, we focus on clinical trials. I tell everyone that clinical trials of yesterday are the treatments of today. What we use today was tested in a trial last year or 10 years ago. And today we are doing the clinical trials that will be the cancer treatments of tomorrow. This is a very exciting new avenue of research, pancreas cancer vaccine trials. These vaccine trials involve taking a patient's tumor sample at surgery, sending it to a lab, and making a vaccine against that person's own tumor. This pancreas cancer vaccine, once given to the patient, immunizes the patient against their own cancer so that when the cancer tries to come back, the body can fight it off. What we learn from this trial in pancreas cancer could be then used to treat other cancers. For example, this approach is already being tested in other diseases such as lung cancer and melanoma, and we have those trials also at the University of Cincinnati Cancer Center. A KRAS mutation, KRAS, is like an on switch in cancer cells. The light is always on, so the cells are always active, growing, multiplying, spreading around the body. These RAS inhibitors are pills, no heavy-duty intravenous chemotherapy. All that the patients have to do is take a pill a day. And these pills turn that switch off. They don't directly kill the cancer cells, but they just turn the light off on these cells, so they essentially go to sleep, become inactive, and the patient's cancer stops growing. RAS is an on switch in several other cancers also, such as colon cancer, lung cancer, and a few others, and these drugs are being tested in those cancers as well. What we learn from pancreas cancer can be applied to those other cancers as well.
Radiation historically has been used to treat pancreas cancer, but based on the existing technology we had, we didn't have the means to give enough radiation dose to get rid of the tumor without causing significant harm to the bowel. This is a clinical trial that's testing whether ablative radiation can improve survival in patients with pancreas cancer who have tumors that are unresectable. Ablative radiation is the same type of radiation, but with ablative radiation, the philosophy is to give high doses of radiation, enough that is able to get rid of the cancer such that it would be similar to removing the cancer surgically. And with the new technologies we have, both with shaping the radiation beam as well as being accurate in how the radiation is positioned, we're able to give enough radiation dose but also spare some of the healthy tissues, in particular the surrounding bowel.
I think in a disease as difficult and complex as pancreatic cancer, it is very important to seek a second opinion so that patients can learn about all the options for treatment, not just the first option. Whether different kinds of surgery, different methods of radiation, different clinical trials with medicines that could be pills, immunotherapies, targeted therapies, personalized vaccines, etc. It makes sense to get a second opinion at an academic center to learn about all the options out there.